Hello everyone, this is Dr. Shilpa Mohanan from the Academy of Online Radiology Education. I work at University of Arkansas for Medical Sciences in Little Rock, Arkansas. This month we have some interesting articles in musculoskeletal imaging. First, I would like to thank our senior editors for their contributions to this musculoskeletal imaging blog. This study is a systematic review and meta-analysis of 8 original research articles on the diagnostic performance of MR imaging for detecting meniscal ramp lesion in patients with ACL tears. The diagnostic performance studies using MRI as the index test and arthroscopy as the reference standard for ramp lesion were included. The authors concluded that MRI demonstrated moderate sensitivity and excellent specificity for diagnosing ramp lesion. Routine arthroscopic assessment is recommended for the presence of ramp lesion regardless of whether it is suspected on MRI. This is a retrospective study involving 235 pediatric patients. The presenting CT scans, MR images or both of these patients who presented with a diagnosis of cervical spine injury were reviewed and the injury level and type was recorded. The report from the presenting radiographs were reviewed and compared with injury findings on CT or MR images. The authors concluded that pediatric patients have high rates of upper cervical spine injuries, which tend to be distraction injuries that are frequently associated with avulsion fractures. Patients younger than 3 years old are particularly prone to distraction type injuries. This is a cross-sectional observational and comparative study to determine the clinical value of ultrasonographic assessment in lateral epicondylitis, the tendon thickness of common extensor tendon, color Doppler activity, and bone spur were assessed by ultrasound in 264 participants with healthy elbows and 60 patients with chronic lateral epicondylitis. The authors concluded that ultrasonography cannot be used as a standalone diagnostic tool, but rather as a supplement to the overall assessment given the marked variation in natural tendon thickness and small increases in tendon thickness in patients with lateral epicondylitis. This is a retrospective study to determine the importance of optimizing minimum attenuation and using a tin filter to minimize clumpy artifacts on foot and ankle dual energy CT. The study was done in 40 patients who had foot and ankle DECT. Images in set 1 were obtained with DECT without a tin filter. Images in set 2 were obtained with DECT with a tin filter. Images in both sets were randomly assigned a minimum attenuation of 130 HU or 150 HU. 3 radiologists independently checked all images, and the authors concluded that clumpy artifacts occurred frequently in DECT without a tin filter. Setting the minimum attenuation to the higher value of 150 HU reduced the frequency of clumpy artifacts, and adding a tin filter to DECT greatly reduced their occurrence. This is a retrospective study of 60 patients with suspected osteomyelitis in the setting of diabetic pedal ulcer. The study was done to determine the MR imaging characteristics which help in predicting osteomyelitis in patients whose initial MRI demonstrated bone marrow edema without corresponding T1 signal marrow replacement. The dimension and the depth of the ulcer were measured. Ratios of marrow ROI to joint fluid ROI on T2 stir sequences were obtained. Progression to osteomyelitis on subsequent MRI was characterized by loss of normal marrow signal on T1 weighted images. The authors concluded that increasing bone marrow ROI signal to joint fluid ratios on T2 stir images were the strongest risk factors for developing osteomyelitis, while ulcer size and depth are weaker predictors. This is a prospective study involving 184 patients to determine the causes of anomalous signal intensity increase on out-of-phase chemical shift imaging. Signal intensity change on out-of-phase sequence was calculated, and for patients in whom signal intensity on out-of-phase sequence increased compared with the in-phase sequence, the available CT studies and the radiographs were reviewed to look for marrow sclerosis or matrix mineralization. The authors concluded that in over 75% of cases, with anomalous signal increase in out-of-phase sequences, CT or radiographs demonstrate either diffuse marrow sclerosis or matrix mineralization. In this prospective study, 18 schwannomas and 11 neurofibromas were assessed in 22 patients to determine the usefulness of diffusion tensor imaging and tractography for preoperative assessment of benign peripheral nerve sheath tumor. Diffusion tensor parameters were computed and fiber tracks were determined. Mean diffusivity was computed. Preoperative fascicle visualization was graded. Fascicles were categorized regarding anatomical location and amount of fascicles surrounding the tumor. They concluded that preoperative diffusion tensor imaging allowed to accurately differentiate between schwannomas and neurofibromas and to describe their location in relation to the nerve fascicles for preoperative planning. In this prospective comparative study, flat panel CT arthrography was compared to MDCT and MR arthrography for cartilage defect detection in the ankle joint. 27 patients with specific suspicion of articular cartilage lesion underwent ankle arthrography with injection of a mixture of diluted gadolinium and iobitridol and were examined consecutively with the use of FPCT, MDCT, and 1.5 Tesla MR imaging. The authors concluded that FPCT demonstrated better accuracy than did 1.5 Tesla MR arthrography for cartilage defect detection in the ankle joint. So that's all from me for this month. Thank you for listening. For more details, you can read our blog where you can find links to the original publications. Please share your thoughts and questions with us on the musculoskeletal imaging blog.